Okay, there you are, Mr. Mayor. Okay,
Keeping you on your toes, Chuck. You're always ready. I know.
trying. You
Sorry.
make me slightly nervous, which is good.
I'm so sorry.
Okay. All right, we'll go ahead and get going. So I am Chuck Carney, Director of Media Relations for Indiana University, and welcome again to our weekly IU Health, Monroe County and City of Bloomington news conference on the developments with the COVID pandemic. And we will have, as always, Mayor John Hamilton, who you've seen here. And then we will have today Kirk White from Indiana University, but also Dr. Aaron Carroll, who is professor of pediatrics and director of the surveillance and mitigation program for the COVID-19 pandemic at IU. He'll be introduced by our assistant vice president for strategic partnerships and the IUB COVID response unit lead, Kirk White. Today, we'll also have Dr. Judy DeMuth, Monroe County Community School Corporation Superintendent, with Mayor Hamilton also, Monroe County Commissioner President Julie Thomas, IU Health South Central Region President Brian Shockney, and Monroe County Health Department Administrator Penny Caudle, and Monroe County Emergency Management Director Allison Moore. To begin with, we will start with the Indiana University part of this, as we had some announcements last night, regarding Greek houses and communal living at the IU Bloomington campus. I'll pitch to Kirk White, who will introduce Dr. Carroll.
Well, good afternoon, everyone. Thank you for joining us again this week. And as Chuck mentioned, yes, as we've started and now finishing our first week of classes on the Bloomington campus, and tested over 37,000 of our students who came in over the last few weeks. It's been quite an effort. And at this point, we're moving now to the mitigation testing phase, from the arrival testing now to mitigation. And the goal of that is to continue to monitor where the COVID outbreaks could be on the campus, and keep a close eye on that. The past week and this semester, we'll see many changes to our operations, and I think our students, faculty, and staff are adjusting as well as they can. But certainly in things like teaching, dining, recreation, and other areas, it's a different environment, but the students seem to be adjusting well, as is our faculty and staff, to this very unusual emergency that we're in. So as I begin to mention mitigation testing, as Chuck mentioned, as we continue to monitor this, we have seen some upticks in a few areas. And let me then turn it over to Dr. Carroll, who, as Chuck mentioned, is our expert on mitigation and testing, and is a faculty member at our IU School of Medicine. Aaron, could you continue to elaborate on the success of the testing efforts this week?
Sure. So it's important to remember that the overall goal of everything we were doing was to start the semester off in the goodest place as possible, and then to do as much testing as we can in order to keep there. So we did on-arrival testing before as everyone arrived. All Bloomington students who were living in congregate settings were tested with an antigen test, and all students living off campus were tested with a saliva-based PCR test. Our results came back at about 1% of the population, which is about what we expected, given the prevalence of, how prevalent the disease is in Indiana. We had students isolate if they were infected, meaning that they had to stay sheltering in place for 10 days until they have no more symptoms if they had symptoms, and they had no more fever if they had fever. But for 10 days since their positive test, we also quarantined close contacts and continued to monitor them for any signs. Then we began mitigation testing this week. And the goal of mitigation testing is to be able to tell where disease might be spreading before it would otherwise be known. So that is what surveillance really is. And so we focused mostly on our highest risk populations to start this week, since they hadn't been tested since on arrival. And since we had a significant number of students either in Greek houses or living in dorms who had not been tested in some time, we retested all Greek house students, as well as all Bloomington and IUPUI on-campus students who had not been tested since August 20th. And the numbers that we're seeing coming back are higher. And one, we expected this, given that they're going to be living in congregate living settings. But two, the whole purpose of doing this kind of testing is so that we could react more nimbly, so that we could see where it looks like this is spreading and not have to do something either campus or school or statewide. And so we are noticing that there's an increased amount of spread in some places, specifically in some of the Greek houses, and therefore working in conjunction with the county, we've taken steps to have greater levels of quarantine and greater levels of separation where we might be seeing that spread. We're going to continue to monitor this as we move forward. It's the whole purpose of doing the widespread mitigation testing. We're going to continue this next week by actually expanding it into faculty, staff, and students on all of our campuses. Although we will, again, really upweight and make sure that we're checking our highest risk populations, which at the moment look like our Greek house students. But we're going to keep on this. We're going to keep taking action as it needs to happen, and we're going to keep collecting and reporting data out as we get it.
So we should mention here that we do have, we have talked for some time about a dashboard of results. We do have a dashboard that is live today. Aaron, I'm going to screen share here and to share what we have there. This is actually a PDF that you will all see if I successfully navigate this, and not the live version. So if it looks static, that is why it is. But this lives at the fall2020.iu.edu site /dashboards with an S. So let's explain what we're seeing here and what we will see here.
Sure. At the top, there's an introduction explaining what the dashboard is and what we'll be presenting. There'll also be a video, which was made by Cole Beeler, another member of the medical response team, along with me and Adrian Gardner, which explains all of the metrics that we will be looking at to monitor, to see how things are going on all of our campuses. Because, of course, mitigation testing, while it is part of this, is just one part of it. There are lots of other metrics that will also help to us to see like how things are going and where we might need to take action on various campuses. And as you scroll down, I think the first area that will come up, there's an introduction to the MRT. You can see my name there, is arrival testing, where we will talk about all the tests that have been completed. You'll see the numbers may be, I think, I don't know if these are the final numbers or we'll update it as it is, but you will see how many tests we conducted, how many tests were positive. You can see, as we've reported before, the testing rate for on-arrival testing was about 1%. And if you keep scrolling down, this is where mitigation testing will appear in the future. Again, we're just starting this week. We have to send our results off to the Vault Labs, where it does take a couple days turnaround time. So we're still collecting data for this week, but when we have it, we'll start posting it, and it'll be broken down by campus as well. And then we have symptomatic testing. And it's important to understand the difference between symptomatic and asymptomatic testing. So, of course, when we're doing the mitigation testing, when we're doing on-arrival testing, you're getting a background prevalence. And that is, of course, much lower than the rate of tests that you see in a sick population, because symptomatic tests, we expect that there's a higher pre-test probability before we do the test. But symptomatic testing is what most of the country is doing. It's what most of you are seeing whenever you look at how is the state doing, or how does this state, when we talk about Arizona or Texas or states that we're concerned about, it's symptomatic testing that we're seeing. And so we want to present that data as well. We will be presenting it with a weekly 7-day trend bar that shows you how many tests we've conducted over that week, what the overall positivity rate was for that symptomatic testing. It's important to understand that this is not the same, again, as background prevalence, because we're hoping that we're actually getting a more accurate read by doing widespread asymptomatic testing to see what is the true rate of disease in a population. But symptomatic testing is part of how do we see how many people are thinking that they might be infected and how many are we catching as well. It is absolutely positively expected that the symptomatic testing rate will be significantly higher than the asymptomatic testing rate. So we just want to, that is just known. You should be prepared for it. I'm sure there'll still be lots of questions, but the symptomatic testing rate is significantly higher than the prevalence rate. But we will also be breaking that down by campus as well. If you scroll down a bit more, Chuck. Oh, I'm sorry, maybe scroll up a bit. because I know there's somewhere to choose it by campus. Oh, it'll be there, I think, on the live. But
I
but
think
we
it's
do.
a function of the PDF here.
Yeah, we do break down a lot of this testing by campus so that you can see what's going on at the various campuses as well. And of course, this will be updated as we have mitigation testing results next week. That will be updated, and as we continue to move forward, it's our goal to keep this updated so you have information on how things are going on IU's campuses.
And the goal is we will update with some testing, some mitigation testing on Monday. Monday will be our regular update day. And one other note, you mentioned the positive rate there, the percentage. It's 62 positive out of well over 100,000. So 62 positive tests in the symptomatic testing that we're talking about. Yeah,
I mean, it's important to always put these in perspective in population. Of course, positivity rate is important, but also the actual number of cases, because if I test 2 people and 1 is positive, that's a positivity rate of 50%, but it's 1 positive. So it's important to have all of those numbers when you're thinking about how things are doing. But it's our goal, again, through mitigation testing, to catch as many people as we can, even if they don't have symptoms, and get them into isolation and quarantine. So we'll likely be picking up more positives through asymptomatic testing, even as we move forward, than symptomatic testing.
Okay. Dr. Carroll will be here to take questions in a moment. We will come back to him for those questions. He does have a hard out at 2 o'clock, so I do want to put that out there for the media on the call. Let's next go to our new member of the panel today, Dr. DeMuth from the Monroe County Community School Corporation. If you want to make some comments about what's going on with Monroe County Schools.
Thank you, Chuck. Yes, we started out in April, May, June, putting together and developing a plan, a comprehensive plan, working through the Monroe County Health Department. And we were asked to put a metric together. So we put 2 committees together, actually, which is an MCCSE metric committee. And then also we put a learning committee together for our reentry and how our students would learn and how that would fit into the metric. Our school board heard that report on Tuesday evening and it was accepted. And so we will be using the metrics. I heard, we just mentioned Monday that all of those metrics would be updated. That's our day, because a lot of the metrics that we'll be talking about and you have been talking about, we are looking to the county health department. We're looking to IU for that information. So our metric really is comprised of a percent positivity, positive cases per day on a 7-day rolling average, positive cases per day, 100,000 unit, and test turnaround and contact tracing, which really are important for our staff, because at this point in time, we are planning on bringing back some of our students. Will start actually on August 31st, and then we'll have students returning on September 8th. So we'll be looking at these metrics that will be shared with us. And then we have a committee that will be pulled together to determine what the following Monday will bring for our education. As you may know, all of our students are virtual right now. And as we look across the state of Indiana, just this morning, about 10% of the school corporations in Indiana are still virtual. So we are working to make sure we are as safe as we can be. I can't say enough about working with Caudle and health department, and then many of the doctors and scientists from Indiana University, doctors from our community, to make sure that we have the safest places possible for our students and staff. And then we superimposed on our metrics an actual green, yellow, red document that placed the learning status. So we're trying to make this easy. If we're in red, our students will be online. If we're in the green status, obviously we're good to go and all students can return. And then if we're in the yellow status, we'll be in a situation where our elementaries will be 5 days a week, and then we'll be in a hybrid at our secondary schools, splitting by alphabet so families can stay together. Regardless of where we're at, we're going to continue with our online learning. So if families decide that they want their children to stay home, we certainly are going to support them online, and we're going to be very nimble. I heard that word already mentioned. We have to be. You know, the one thing we've learned about this is that we're going to work with and around COVID, and we're going to be very nimble in what we have to do, because we are going to keep our students and staff as safe as possible, but we are learning a lot. Every day we learn more. And so our plans have to be flexible to respond to that. So again, thank you to the community because they have been very helpful in putting the plans that we'll be moving forward on starting actually Monday with a few of our students and then September 8th.
Okay, let's next go to Mayor Hamilton for some remarks.
Unmute, thanks. I'll be quick. We've got new voices and I really appreciate hearing that. We will be maintaining our 15-person social gathering limit in the city, which went into effect last week. We've had about 3 dozen complaints over the past weekend and days. Just to give people a sense of that, we're working very, very well with Indiana University Police Department and our Bloomington Police Department to respond to those. Certainly the words about the monitoring that IU has been doing and looking at potential flashpoints is critically important. We look forward to that. And I'm going to close. This is a stretch, I know, to make it COVID, but it's important to get out and enjoy the world too. I'll just mention that the dog parks at Switchyard Park are opening at 5:30 today if you want to go there and get a little break from all of this news. Otherwise, I'll pass it on to the next folks. 5:30 at the Switchyard Park if you want.
All right. So that is good news. All of us who have passed by there on the Beeline a lot, who have been looking for that. Let's go to Julie Thomas.
Hi, thanks everyone for being here. It's great to see such a full contingent of participants with such great information today. Just a couple of quick notes. The county is making CARES funding available to businesses and social service organizations in the community. This is to reimburse them for non-payroll COVID-related expenses that have not already been covered through other funding. So you could visit co.monroe.in.us right on the homepage under breaking news. As of yesterday, we've received 36 applications, 16 were completed, and the total is about $55,000. We're also helping out some of the taxing units in the community, and we have one that received just under $19,000. Ms. Caudle will talk about, I'm sure, the exemptions and the complaint form that are available online, so I won't go into that. I just want to remind everyone as well to be sure to register to vote by October 5th. And one website you can use is monroecountyvoters.us, or you can go to indianavoters.com to see if you're registered or to complete your registration form online. October 5th is a big date. With the end of the moratorium on evictions and utility disconnections, the Board of Commissioners worked with the County Council to create a fund for township assistance. And so everybody in the county lives in a township. If you are going to be struggling, or you are struggling to pay for shelter and utilities and other necessities, please contact your township trustee. We received a report this week that so far we have provided $12,000 in funding to county residents to keep them housed and sheltered. So that is a great thing. Thank you everyone for all your hard work in the community, from the healthcare workers to everyone who does their job and keeps us safe. And please wear your face coverings. I'll be here for questions if there are any. Thank you.
Okay, let's next go to Penny Caudle.
Good afternoon. Thank you. I really just want to limit my comments to answering questions that we have received over the past week and things that people are interested in. I know that there's been questions about the Indiana University numbers and the state's dashboard, and certainly some of the university numbers are coming into the dashboard. They're not all there. I do believe that that's a slow process, but the state has indicated that all the universities, those numbers will be included in the community dashboard because they are part of our community. As you know, we are not in little silos. We are a community together, but there will also be an opportunity for us to be able to separate out that information. So I'm sure that there will be some of the testing that may be done that may be separated out from the dashboard, but for the most part, it sounds like it will be included in there. It's certainly not all there yet. And then we'll have the opportunity to either get a weekly report or access some data so that we can also look at it individually, that we can separate out a university from the community and look at it from various angles. The dashboard on the state has changed a little bit. We see that happen every few weeks or so, it seems. And again, related to questions and being more transparent. So they do list now individual tests versus overall number of tests. So you may have an individual who tests multiple times. So you'll have them counted once as an individual, a unique test. If they receive multiple tests for some reason, then that would be counted in the total of tests. So today we had 1,030 positive tests as of today. Our 7-day positivity rate for individuals was 2.3%, 3.9% in cumulative numbers. And again, daily numbers, depending on the number of tests that are done, the situation for those individuals who are tested on that given day, your positivity rate for that day can vary greatly. So just keep that in mind. If you, Dr. Carroll really talked about this too, if you have a day where you have a lot of people who are symptomatic who get tested, you're going to have a high positivity rate. You might have another day where you do the same number of testing, but it's asymptomatic people, or it's just simply people who are not infected, I should say. And you're going to have a low positivity rate. So again, data to keep in mind, and it's why we say that we have to look at the big picture, and it's like putting a puzzle together. There isn't one set of information to guide every decision. The other thing that I want to say very briefly, we've had questions about sporting events and schools, and the Indiana High School Athletic Association put out guidelines for sporting events, and specifically a lot of them are focused on football, but they can be taken across different sports. They put together some good guidelines about sectioning off groups of people, how that can be done with separate entrances, separate restrooms, those kinds of things. The one thing that the Athletic Association did was put a cap of 250 per section, and that goes along with the state limit on sizes. However, locally, we have a limit of 150. So for those football games, outside events, each of those sections would have a maximum capacity of 150 or 50%. And so it may vary depending on the size of the area. If, we've talked with schools and they seem to have good plans in place for how they're monitoring that and doing that. And I think as with everything, every business, everything that we do when we're starting out, we see what works and what doesn't, and then we adapt and change and fix what didn't seem to work well for us. So we are here to continue to work with the schools on those plans and help assess them the best that we can if they need that. The complaint system that we have in place, you can go to our website. If you find a business is intentionally not complying with the orders that we have in place, you can certainly file a complaint with that. This week so far, we've had 36 complaints. Most of them have been on masks. Most of the time it is on patrons not wearing masks, but not always. And so again, what we're really interested in knowing about are those businesses that are intentionally non-compliant. Many times we've went out and the business is really trying. They've got a good plan. They're trying. They have people at the door monitoring those kinds of things, and we work with them for whatever that challenge may be. We work with them to try to figure out a way to improve even more. But we have found that time of day makes a difference, day of week makes a difference. We had one complaint, staff went out to the grocery and couldn't find a single person not wearing a mask. So the signs were there, people were checking, and I'm sure when the person that complained went, there probably were people not wearing masks, but when we went, we saw a lot of compliance. The gatherings really are we have to remember that gatherings without caution to risks and taking our mitigation and our prevention practices, regardless of where we live, how many people we are with, all of that makes a difference. So a sleepover or a birthday party of 5 people could very well be as risky as a picnic of 25, depending on the actions of the individuals who are there and whether or not someone who's in attendance is infected and contagious. So the mandate for masks, the governor did extend, but that whether we have a mandate or not, masks and physical distancing and hand washing, all testing, all of those things are going to be with us for some time. And the last things that I would say is remember to keep up or catch up on your immunizations. Get your flu shot. It is time to start getting your flu shot. You can call our public health clinic at 353-3244 if you need to make an appointment for an immunization that you missed, and they'll be happy to help you with that. We are working on plans, hoping to do some community-wide flu clinics. And as that unfolds, if we can get those together, then we will share that information. And we are also working on plans and preparing for vaccination clinics for COVID-19 when that vaccine becomes available in 2021. That's what I have for today.
Okay, and I'm cognizant we have some questions piling up. We will get to those in just a moment. Quickly to Allison Moore.
Good afternoon. I will speak quickly on 3 quick things and then be available for questions, as I know that there are lots of speakers today that we have lots of wonderful information on. Quickly, the blood drives are scheduled for the 2020 calendar year that are put on by the Board of Commissioners. They are held at the Monroe County Convention Center from the hours of 10 to 3. And those 4 dates for the remainder of this year are September 29th, October 22nd, November the 9th, and December the 21st. You can register for an appointment slot for those at redcross.org. There is also a flyer on our county website. The second item I'd like to mention is we, as always, have a mass distribution system where we send out notifications as health orders that have been updated and weather-related events. And with the upcoming weather that we might potentially have this weekend, this is a non-COVID related item, but I'd like to just mention that you can register for that also on our county website and get signed up for those mass notifications. And the last thing I'd like to mention is we are continuing to hand out masks and have those readily available for any Monroe County resident that might in fact need a face mask or a face shield to have that face covering. And we have a list of various places in our community where you can go and pick those items up, and we are happy to assist you in any way to fulfill that you have that requirement. That's all I have, Chuck. Thank you so much.
Hey, Brian Shockney, please.
Yes, thank you, Penny Caudle, for mentioning the flu vaccine. We will be holding, in conjunction with the health department and others, flu vaccines across the community. We need to be sure that we're getting our flu shots this year. It is more important this year than ever because of the COVID-19 as well as the flu. Just know that the safety precautions that we're covering and we're doing with COVID-19 are the same things that we're seeing in the Southern Hemisphere that are keeping the rates of flu low. We usually look to the Southern Hemisphere for how our flu season is going to go, and it's going well down there. And from what we can tell, it's due to the practices, safe practices that they have regarding COVID-19. And the last thing I want to speak about here is mental health and wellness. Today is National Thoughtfulness Day. Several weeks ago, I stressed the importance of not only focusing on protecting ourselves from the virus, but also the emotional toll that all this can have and is having on our community. iHealth Bloomington and our South Central Region hospitals, we continue to see rapidly increasing numbers of patients expressing behavioral concerns and physical violence. We have seen a 22% increase in utilization of our behavioral health services over the past 2 months alone, and increased violence outside and inside of our walls. In the past 2 weeks, this has become personal to my family and my son, who lives in another state, as he was diagnosed with COVID-19. He's followed his dad and mom's. His mom's a nurse and his dad works in healthcare, and he's followed our advice but he contracted it through a roommate. And he's young, so his symptoms were not fun, but they were minor. But he had to forego a paycheck during this time off, lose personal contact with people for a minimum of 2 weeks, and had worried parents 5 hours away that are both healthcare people and know what can happen. So I tell you this because we all live in some level of fear of contracting the virus and not knowing how it affects us. Yet we need to ensure we keep all of this in perspective and do all the things we can to protect and do self-care. Worry and isolation, concern for our loved ones, and the personal fear that when you're sick cannot be underestimated. When we must take walks outside, that dog park would be a good place to go today. Take time away from technology and news, connect with our loved ones in meaningful ways, even if it's virtual, and seek professional help when we don't feel we can handle things on our own. People experiencing mental and behavioral health issues or changes are encouraged to visit our IU Health COVID-19 Your Health and Wellness for mental health and wellness resources. And in the chat, we will put some Indiana Suicide and Prevention Crisis Hotline and other contact information. Thank you. Lastly, thank you to our health department and our unmasked hero, Penny Caudle, for her great work. And then the mayor and the commissioners for the great work that they do. And I just want to say that our commissioners cannot be valued enough given the work that they put in without COVID, let alone during this COVID period. So thank you all.
Okay, we will go to questions, and there are several lining up for Dr. Carroll. We'll come to you here first. And one correction, this is from Eric Berman with WIBC, and he asks about how many of the IUB positive tests are in the 10 quarantine Greek houses. It's actually only 8 that are quarantined. I think there was an earlier AP story that said 10. It's actually 8 in those houses and communal living facilities. Much more of that detail will be in the mitigation results once we have a fuller picture. Do you want to elaborate on that, Dr. Carroll?
I mean, I don't have an exact number to relay, but you can be assured it was more than in the houses that are not under quarantine, because of course, if we're seeing more cases, then those are the houses that we want to work with the county on to try to take measures to keep everybody safe.
And the next 2 questions he has: how many in other Greek houses? Is there a threshold for quarantining a Greek house, or will one case cause a quarantine? Well, obviously it's fewer in the other Greek houses.
Well, I would say, first of all, it's important to understand that even one case gets isolated automatically. There is no, we don't just let any cases wander around, and any close contacts are immediately quarantined as well. So we act on any positive that we see and on any close contacts so that people are isolated or quarantined appropriately. I think what's happened that differentiates those 8 houses from others is that there were enough cases that we felt that it would be almost impossible to make a determination of who was not a close contact anymore. And therefore, given the tight quarters of a house, it was better to quarantine everyone in the house while we're still absolutely isolating the infected cases.
And next question here, first of all, a quick point about the Greek houses. This is something that we prepared for in this plan we've been working on. This is in some ways not a surprise because, you could predict some of this.
Well, I mean, I don't like to use the word predict because that means we thought it was absolutely to occur, but it was definitely something we considered and we knew was possible. And so, again, being very consistent, we've been saying since the beginning that one of the reasons to do this high level of mitigation testing was so that we could determine in specific populations all over our campuses where issues were that we would need to act upon. And the textbook for interacting is very much the same. We can quarantine and isolate those who are infected to prevent the transmission, to slow any spread any further. That's how you try to contain an outbreak of infections. And it's important to say that we knew that we would interact anywhere that we thought that there was such a collection of infections, and whether it was in dorms or in a building or somewhere else or in a Greek house, that's what we need to do. And so given that we have detected that there are increased cases amongst some of the Greek houses, we're taking the plans and thoughts and actions that we had considered before and putting them into place so that we can, again, act on a very local level to contain this before it gets any further.
Another question from Eric for you, Dr. Carroll, or perhaps Kirk could take on some of this. He asks, what, if any, steps will be taken and by whom to ensure Greek houses abide by the quarantine? We're going to be in communication with these houses constantly through health professionals and IU.
And we're going to be working with the county as well, because of course, we do not own the Greek houses, and they are to some extent off-campus living, although we know that they are congregate living, and we're certainly worried about their higher risk and consider them part of the IU community. But for actual enforcement, I would defer to Kirk.
Nice. So there we go. Our first line, of course, is with our Office of Greek Affairs and Greek Student Life. They're monitoring and working with these chapters very closely, as they have through the summer. And the guidance that we gave them when we saw the need for all of our housing opportunities, whether they be on campus or off campus, to have a plan in case you needed to do isolation or quarantine. So those plans have been submitted to the Office of Greek Affairs, and so now they're looking to make sure that those plans are being followed. And part of the quarantine is a ceasing of all extracurricular activities, more or less, by all of the chapters. This will stop a lot of the planned events that may have been spreader events, and the shorter answer to the question is that the Greek Affairs Office at IU, since these are recognized student organizations, though not university housing, if they want to maintain their student organization status and have that level of connection to the university, then they have to abide by our rules. And I think I could ask Penny Caudle if how the county, since this is a county health order, how the county might assist in this enforcement as well.
Certainly. Thanks, Kirk. I appreciate that. In terms of quarantine or isolation kind of orders, we generally start, regardless of what the situation may be, with a notice that you need to quarantine or you need to isolate. If someone or if a house did not comply with that, then we could look at doing an actual health order and even a court order to do that. So those would be your worst case scenarios. And always we're looking to work with individuals. Earlier this month, the health board made recommendations, which we had been working with the university, on recommendations for communal living situations. The board put out those recommendations earlier this month. They are looking today at whether or not they want to turn those into regulations, which would actually also have more enforcement opportunities with that too, should they be needed. And again, even with the letters and the information that have went out to the Greek houses, they are reaching out and trying to do the right thing. They've taken actions, and that's always what we want, is to work together to do the right thing so that we don't have to take those enforcement actions that we can do.
Question from Dave Askins, the B Square Beacon, asking, the County Board of Health issued specific guidance on August 5th that residential and communal living facilities were supposed to follow. Is there any evidence one way or another that the Greek houses that are now in quarantine were previously following the County Board of Health's guidance? Kirk, this refers partly to what you were talking about with our offices that work with them. I would say generally no, but we would find out if there was working through those offices. They'll be looking into that.
Yes, absolutely. The Office of Sorority and Fraternity Life is, our mission is to make sure that the campus stays as safe as it can, which then makes the community safe as well. And so there's a lot of empathy going on here. And at the same time, some very stern direction. We understand the challenges that this pandemic is causing the entire community, our state and nation. But in our situation with these houses that are communal living, we want to make sure that they've got the tools to do what they can to follow these guidelines. Some of these houses are better equipped to do this than others because of the way their living arrangements are made, or the blueprints, the layout of the house. So some have better ability to follow than others. And if we look at each of those things and then talk about alternatives. In some cases, some of these students may go home if they have an environment where they could isolate or quarantine themselves there safely.
And let me correct my wording. I said no, meaning that there was no evidence of that they hadn't followed those guidelines at this point. So just to make clear on what I said leading into that question. I actually don't see any other questions, but I'm going to do my vamp here. If there are some that you want to get in here under the wire, because I know we have quite a few media tuned in here. We will be, again, for speaking for IU, the dashboard is up, and we will be updating that every Monday with the results of the mitigation testing, which is ongoing and started this week. And so you can find that at fall2020.iu.edu/dashboards. And you can find that on our website for the fall 2020 semester. Mayor Hamilton, go ahead.
I was just, you got another question. I was just going to say, this is exactly what we want to have happen, which is we know these are risky days and weeks, and finding the problems and stepping in quickly, looking for the high risk places is exactly what we ought to be doing. And we still don't know how it's all going to shake out, but I just want to thank everybody for following those protocols and being ready the way we have been.
And Dr. Carroll, I want to squeeze in a couple of quick questions for you because I know you have to go. From Michael Reschke at the HT, he was saying he thinks this may have been addressed earlier, but he was asking if what were the, quote, alarming increases in positives. That's the words from the public service announcement last night for Greek houses. He's looking for specific numbers. We don't have overall specific numbers, but can you speak to that?
Yeah, I mean, again, our background prevalence to begin with was about 1%, and we've seen it tick up along the lines of what we've seen at other universities. It's just that when we see an overall increase, we actually can break that out into look in specifics, and the increase we're seeing in the Greek houses is driving a significant amount of that overall increase. That's enough for us to get concerned and focus our attention there. And we can do that, one, by taking actions like we're doing right now, but two, by continuing to test regularly. So we will likely test all of our on-campus Greek students again next week as well, to make sure that we're picking up every single positive as it comes along and getting it into isolation and keeping and continuing and expanding quarantines as we need to.
And one more from Eric Berman for you, Dr. Carroll. Has contact tracing indicated where the infections began, mass gatherings, students already infected when they arrived in Bloomington?
It's difficult to say. One thing I will say is that we tested all these students as they arrived. So we clearly picked up some infections then, and we hope that they get put into isolation and quarantine to begin with. But of course, if they've already been around other students, it's possible that they had spread it before they began. And then, of course, as students all continued to gather, this is our riskiest time. When people are arriving from off campus, when they are, all starting to congregate together, when they haven't been for some period of time, I expect that they did get it partially from each other. I think that probably there was less spread than there would have been, given that we did the testing on arrival to weed out some of the positives earlier than they otherwise would have been picked up. But no system is perfect. And so we need to continue to do this again and again to try to stay ahead of it.
Okay, Dr. Carroll, I know you have to go, and that looks like the last question we have for you at the moment. Ethan Burks from WFIU, WTIU, thank you, Dr. Carroll, asks a question for Penny Caudle. And I know, Penny, you answered it online here too, but just to get it out for everybody else. As you mentioned, IHSAA guidelines allow 250 fans at sporting events, but the county rule is 150. Did you say the county guidelines supersede that, and have there been any complaints about Bloomington schools not following those attendance guidelines?
Ethan, yes, 150 is our local limit, and that is per section. So the Athletic Association guidelines are what we expect to be followed. But instead of 250 as a maximum, it is 150 based on our local numbers. We have had people ask and question about various schools, and that's why I brought this up. I wanted people to know what guidelines we were following, and the schools that, as we have been in contact with them, have been aware and following the guidelines. And we have a variety of school plans right now that we're trying to look at as sporting continues, and we start looking at coming in indoors, and certainly that will be a little bit more of a challenge as well. Although I have to say, on a call, we're talking, some of the schools say they actually have more room inside to do things and section off than they do at their outside arenas.
So can I just make sure I understand, and for the public, when you say sections, for example, on a football field, you could have multiple somewhat isolated sections. So the total attendance could be quite a bit more than 150. It's just by each section that's controlled, you'll allow that much, right?
That is correct. The Athletic Association put out some very specific guidelines about separate entrances.
Great.
They can't mingle, so you can't have different sections mingling, restrooms, all of those things in place. Yes.
Great, thank you.
For those of you who are interested in South football, the rumor is going around they have sold 800 tickets. Well, that's not true. They have 3 sections of 150 each. So, and they have separate entrances, exits. There's social distancing, and masks must be worn. So they're addressing the problem, but there's always misinformation wandering around out there. It is not 800 tickets. So
okay. That was Dr. Sharp. So,
and Chuck, if I may, Judy DeMusa, our principals are really working along with our athletic directors to make sure that we follow all of that guidance. As you can well imagine, our kids have been moving into other communities for athletic contests. We are observing the mask requirement in our Monroe County Community School Corporation. So any persons that attend, they will be asked to wear masks. That seems to be our biggest problem right now, with people thinking that they don't need to use masks. But on our campuses, in our facilities, we will have masks on. Okay.
Other quick question. This is from Stephanie Wade, and I'll address this. Would IU take any action if a certain amount of students test positive, any more Greek houses test positive and need to quarantine? And I assume by action you mean possibly moving online. There are a myriad of factors. It's not simply one. It's not even simply just numbers of positives. So we'll assess all of those different factors before we take an action. And of course, if another Greek house is determined to need to quarantine in consultation with the county, we would certainly do that as that time would come. That is our time plus a few minutes of bonus time. So if you will look for the email next week, we will be back next week for another Zoom news conference session. Appreciate everybody's time, your questions, and attendance here today.
Thanks, Chuck. Thanks, Judy, for being here too. Appreciate it.
Thank you so much. Thanks.